Discuss about bone scintigraphy today. It is done with using technetium 99 MDP, which is a radio tracer, and indications are trauma, infection, inflammation, neoplasm, metastatic disease, metabolic bone disease, treatment monitoring, or to look for the bone viability. And this is a multiphasic study, dynamic study. So first phase will be the flow or hyperperfusion phase, second phase will be the blood pool or hyperemia phase, and third one will be the bone uptake phase. Whenever there is osteoblastic activity or reparative bone process, there will be increased uptake of technetium 99 MDP, and usually a scan is done after 3 to 6 hours of radio tracer injection. So this is the normal anatomy of an adult. There can be some uptake of tracer into the hematopoietically active axial skeleton or as well as the appendicular skeleton. And in children there can be increased uptake in the physis region of the growing bone because of the increased bone activity and the radio tracer uptake. So in this scan we can see there is increased uptake in the maxilla on the left side as well as in the thyroid region and the spine in the posterior scan in the spine. So this type of uptake can be seen in the thyroid and as well as the osteophytes of the cervical spine. This is the benign uptake. So whenever there is a discrete and multifocal uptake, which is random distribution of radio tracer uptake, this can be seen in the case of lung carcinoma metastasis, and this can be seen in the axillary as well as the appendicular skeleton. In this scan we can see there is a diffuse uptake in the axial skeleton, in the pelvic bones and the spine, and this without any uptake into the bilateral renal fossa or in the bladder. So this type of scan is known as a super scan, which can be seen in any carcinoma or metastatic disease. In this scan we can see there is radio tracer less uptake or less intake in the spine, which is a case of radiotherapy, post radiotherapy treatment. So there will be less uptake in the this exposed region. And in this scan we can see there is linear arrangement of radio tracer uptake into the rib as well as in the contralateral side and in the appendicular skeleton. This type of uptake can be seen in the trauma patients post fracture. There is increased uptake into the plantar fascia in the calcaneal region, and this type uptake is seen in plantar fasciitis. So in this scan we can see there is increased uptake into the right tibia. This is a stress fracture of tibia. There is increased uptake in medial end of the bilateral tibia, and this is known as a shin splints. This is a case of AVN. There is in early phase there will be less uptake of radio tracer. In mid phases, after some interval there will be increased uptake due to the bone reparative process is going on, and after some time there will be deformed head and the left of the left femur, and this is picture of AVN. In this case we can see there is increased uptake into the calvaria as well as the mandible bone, and this type of uptake can see in the Paget's disease, and there will be deformed bone which increase uptake of the radio tracer. There is increased uptake into the axial skeleton as well as appendicular skeleton, but this type of uptake is more is seen in more in the cortex as compared to the medulla, and they on the 2D image we will see the two parallel line of increased uptake, and this is known as a tram line sign seen in the hypertrophic osteoarthropathy, which is a process of or complication of any thoracic or abdominal neoplasm. The diffuse uptake in the unilateral hand, and this type of picture can be seen in the reflex sympathetic dystrophy. And in this scan we can see there is increased uptake into the posterior elements. This type of uptake is normal in the physis or growing region, and this is seen in case of spondylosis. There is increased uptake in the heart with excretion into the bladder, and bilateral kidneys also visualized, and there is some uptake into the peritoneum, which is a ascites. So this type of picture can be seen in the congestive heart failure. These are the three phases of bone scintigraphy. First one phase is the flow phase, and this is the blood pool phase, and third one is a bone uptake phase. We can see there is a uptake in the lower end of the femur as well as the tibia, and this type of picture seen in the spontaneous osteonecrosis of the knee. There is increased uptake into the right side of the abdomen as well as in the liver, and this type picture is in the colonic carcinoma with liver metastasis. And there is increased uptake into the left scapular region on the AP bone scintigraphy, and this type of pictures in the rhabdomyolysis due to the any process. And there is increased uptake into the splenic region. This is the posterior view. So this is the spleen, and this is case of splenic infarct. There is increased uptake in the first. We can see there is discrete and multifocal intake of radio tracer. After 3-month interval, we can see there is increase in the size of these uptake as well as the new appearance of the lesion. And after 3 months of this scan, there is lesser uptake in the previously lesion as well as the disappearance of the lesion. And this type of picture can be seen in any cancer after treatment, because of the treatment response there will be increased uptake for some time. This is also known as a flare phenomena. This is not a case of progression of disease, it's a normal process or post treatment process, flare phenomena. And in this scan we can see there is increased uptake into the body of the vertebra. Axial, this is the axial scan, and this is the coronal scan, and this is the sagittal. And there is increased uptake into the body as well as the appendicular skeleton as well as the posterior elements, and this type picture seen in any metastatic disease. And these are the 3 phases of bone scan. This is the flow phase, this is the blood pool phase, and this is the bone uptake phase. And we can see there is increased uptake into the greater toe in the all 3 phases, and this type picture is very suggestive of osteomyelitis. Thank you.